Hello, my name is Connor, and welcome to my research proposal presentation focusing on smoking and cardiovascular disease. The question we're aiming to answer here, or provide information toward, how do varying levels of tobacco use impact the prevalence of cardiovascular diseases? So why focus on cardiovascular disease? Well, cardiovascular disease is the single leading cause of death worldwide. Almost half of United States citizens are diagnosed with some form of the disease. Cardiovascular disease may lead to stroke, heart failure, and cardiac arrest. CVD also increases the severity of respiratory diseases and conditions. As our populations continue to grow, more people will be impacted by CVDs, and CVDs disproportionately affect low-income individuals and families and significantly decreases an individual's quality of life. Why tobacco use? Well, it's been linked. We know that it's linked with increased chances of developing CVD based on previous studies. Smoking is the single most avoidable cause of disease, disability, and death worldwide. It also damages the respiratory system and impacts circulatory system by lowering good cholesterols, raising the fat content of blood, damaging blood vessels, causing blood to thicken, increasing buildup of plaques, and potentially blocking blood flow. Some gaps in our current knowledge. Smoking is linked to CVD, we know, based on the body of data that we have access to already from the Framingham Heart Study. But how does the level of tobacco use impact the risk of developing CVDs? What are the differences between occasional, light, and heavy tobacco use? How does this data compare to exposure to secondhand smoke? And how are different demographics affected? Benefits of filling these gaps. It would increase the understanding of the relationship between tobacco use and cardiovascular disease. Be beneficial to know how much the risk increases between levels of tobacco use. It also decrease the level and frequency of tobacco consumption and could be the beginning of quitting. Believing that smoking in any capacity has similar impacts may lead to increased use and risk, but if an individual knows that lower levels of use are healthier for them, then maybe they would choose to smoke less. A better understanding of health benefits associated with lower levels of use without the pressure of quitting entirely. Some basic demographic information would lead to a better understanding of which populations are at a greater risk, and it could help identify how levels of smoking affects non-smokers through secondhand exposure. So why this study? Well, we have a vested interest in both smoking cessation and decreasing incident rates of CVD. We have significant background in biology and various methods of research through our education, and we are dedicated to improving public health resources and the public's understanding of the risks. This study will utilize both qualitative and quantitative methods. For the qualitative section, data will be collected through one-on-one interviews with participants who are current or previous habitual smokers, tobacco users. And questions that we ask are posed not necessarily to answer our research question, but to gain a better understanding of how the individual feels about tobacco use. Questions will also be asked about their family history of cardiovascular disease in order to determine any trends there. Some indicators for various levels of tobacco use. Basic demographic information will be collected and compared. The individual's ideas on smoking cessation, and the setting in which they use tobacco, and the level of exposure that they give the public here. Public exposure to secondhand smoke or the individual's family. And these responses will be analyzed for trends in content. Quantitative methods that will be used. Study design will be cross-sectional, which will allow us to examine single points and times and compare the data over periods of time. Utilize existing data from Framingham Heart Study and Population Assessment for Tobacco and Health. Both of these studies have a significant data pool, and we plan to use this existing data to compare trends in levels of tobacco use and prevalence of cardiovascular disease. Demographic information can also be compared in order to find connections between individuals and groups, as well as other determinant risk factors, and several levels of tobacco use will be examined. Applications of these findings. The comparison of levels of tobacco use and prevalence of CVDs will help people make healthier decisions about tobacco use. Hopefully, it will reduce the prevalence of cardiovascular disease and smoking deaths and increase the public's understanding of the negative impacts of tobacco use. They'll also use the data to contribute to the existing body of research. The one-on-one interviews will help clear up reasoning behind different levels of tobacco use, determine participants' prior knowledge of the impacts of smoking, allow for a comparison between different demographics, examine some risk factors for secondhand smoke exposure, and increase the understanding of the participants' views of smoking cessation. In order to communicate these findings, they'll be published into public health and cardiovascular disease journals. Ideally, results will be presented at national conferences. Community outreach will be utilized, and community groups will be notified. Findings will be presented at health fairs, and hopefully some flyers will be distributed, making the information easily understandable and accessible. Results will be shared with healthcare providers, community groups, public health associations, federal agencies, as well as state and county health departments. Thank you for listening, and I appreciate your time.